Hello, I'm Aarti Sarwal, the social media editor of Critical Care Medicine. The October issue, available now, has a few articles that are a must read. This issue has a foreword from the American College of Critical Care Medicine describing the new living guideline process. SCCM has published 17 guidelines in the last 8 years. This new process will allow our recommendations to be updated in response to important changes in the literature and at the level of individual recommendations. While on guidelines, don't miss the practice guidelines for rapid sequence intubation in the adult ICU patient. In another article from Nijmegen, Netherlands, investigators report on the impact of structural moral case deliberation or debriefing on wellness of ICU professionals. Tanya Egudeji and Matt Martin, in their editorial to this article, debate the differences between moral distress, burnout, and the impact of COVID-19 pandemic. Lastly, a very basic ICU monitoring paradigm, non-invasive blood pressure measurements in the arm. What happens when you can't measure it in the arm and want to stay with non-invasive strategy? You measure in the leg. In this study from three French ICUs, investigators compared continuous non invasive monitoring using a finger cuff device to measuring blood pressure in the arm, the leg, and compared this with an arterial line. They compared validity and bias of measurements based on ISO standards, the ability to detect low and high blood pressure extremes, and the trending ability for each way of measuring it. Check the article out. For more articles, please follow us on X or Facebook. Happy fall or autumn based on where you are. Goodbye.